All right, Jasmine. So let's just start off with your background as a hygienist and all the other stuff you do.
Okay, so I have about 15 years, approximately 15 years combined experience in dentistry and dental hygiene. I started off my career actually in high school. I went to a specialized high school that had dental assisting, and I completed that program. And then I stayed for a few years in New York City, and then moved to Maryland and finished my dental hygiene degree, AS degree, at Allegheny College of Maryland. And then I went on directly after finishing that and did my bachelor's degree in dental hygiene. What I decided to do is my focus of concentration was to work with the HIV/AIDS population. And at that time, no one had actually did a concentration on that particular vulnerable population. So I was going in there kind of blind and like, okay, what is it that I'm going to do? But they hooked me up with a HIV/AIDS expert, Dr. Valerie Meeks. She's the director of the PLUS program there at University of Maryland. And I had a chance to mentor with her. What's really interesting with her is that she was a hygienist first, and then she became a dentist. And she has devoted her life and career to that population. So when I had the opportunity to study with that population, I also was offered a job to work there part-time. So by working there and being engrossed with that population, I had a lot of experience with working with the LGBT community, and actually treated my first trans patient of many trans patients there. So I was there for a few years, and then fast forward now, I'm an educator. I work full-time at a community college, and I had the opportunity to teach public health, which is one of my first loves, and amongst other courses. But with that particular course, I was responsible with coordinating a panel discussion. And I don't know if you remember public health. I'm not sure if that was one of the courses that you enjoy. But there's an aspect of that which is cultural competency that's required for us to discuss with students. But unfortunately, when you think about cultural competency, it's very limited. They tend to focus on ethnicity and not really delving into the other aspect of diversity. And that includes mental health, physical, gender, sexual orientation, both of those. So I thought to myself, this was in 2014, early 2014, what is it that I felt I didn't know as a student? I had excellent clinical training at Allegheny College of Maryland, and just did not have enough experience, especially with the trans community. And I thought, well, what's a great way that I can give a leg up for the students? And so I coordinated a panel discussion, and I took the interprofessional approach to that. And I had a dentist, a psychologist, and 2 community representatives there. And it was a phenomenal conversation. So from that experience and my personal experience with working with that population, I created a course, and that is just focused on helping clinicians to provide culturally appropriate care. And so I'm actually leaving full-time instructing to finish my master's degree, which is one of my goals that I've been trying to accomplish for some time now. And I just started a side business, which is called Beyond the Prophy, which is where I'm going to focus on educating dental professionals about topics like this, and medical professionals also that treat vulnerable populations.
Are you still doing clinical now, Jasmine? Or?
I am not, I've temped here and there, but I actually just accepted a position at Chase Brexton, which is a nonprofit organization. And what's really interesting about them is that it opened in 1978, and they were actually one of the first dental clinics that were involved with the HIV/AIDS epidemic in the 1980s. So they're very unique, which is bringing me back to my roots with public health, because they actually have an LGBT resource center, and they also have services, trans care for adolescents, younger individuals, as well as adults. So that's a very rare thing to see in public health, which is what I'm excited to do. So once I am done with my responsibilities as a full-time instructor, I'm going to be working with them part-time.
Very good. That was a good point that you brought up, Jasmine, because I'm thinking back now to my public health course, and we talked about, you know, diversity, but cultural competency, basically. I don't recall talking about, you know, homosexuality or trans or anything like that. It was all about, you know, yeah, like you were saying, race, ethnicity, that kind of stuff. So, and that was in 2005, 2007 time frame. So that wasn't that long ago, you know.
Yeah, yeah.
And we
Same
didn't
for
touch
me.
on it at all.
Yeah, yeah.
That's good. All right, so let's get into it, Desmond. I guess we can probably just start off with a basic definition for the people that really don't know anything. You know, like, what is LGBT? What does it stand for?
So LGBT stands for lesbian, gay, bisexual, and transgender. Some individuals may see, depending on the facility and institution, LGBTQ.
Mm-hmm.
So that is lesbian, gay, bisexual, transgender, and queer. Both of them are acceptable. And actually, there is, from one of the resources that I found, there's a 12-letter acronym.
Yeah.
And obviously that's way too long. I don't have it memorized at all.
Yeah.
So LGBT is actually acceptable for the workplace or learning institutions.
Okay. Yeah, because I was doing some reading before this, and yeah, there's a lot of different variations out there. You can see it's like kind of evolving, I guess, like over times here.
Yeah,
So,
absolutely, absolutely.
do you want to get into like the barriers and challenges that the community is facing? What are the issues out there for them?
There's so many, and the first, I guess I can start with the demographics. It's understanding that is it really truly clear, the demographics, and when you look at it, it's not only we're talking about the population, but also those who identify it as well in dental hygiene in our profession. So the U.S. Department of Health and Human Services, they put out the Healthy People 2020 objectives. And they have listed for the first time that the LGBT community is vulnerable. However, they don't have adequate research. It's not enough. And so that is an issue, because how do you create programs to take care of all of their needs without the adequate data? And it's even more so in the dental field. Mm-hmm. So that is a tough thing to deal with, especially when it comes to, you know, dentistry. If medical is having limited resources, what's happening on the dental field? And another thing that we find is that there's a history of discrimination. They have been subjected to inhumane treatment, violence, especially towards trans women. And because of that, that's created some barriers where they may not feel comfortable receiving care. There's a lack of training, cultural competency training for healthcare professionals, which has led to, you know, certain barriers. And so the community may not feel, you know, that they are not receiving adequate care because professionals may not have the right attitude, or they just don't know what to say. And there are very few clinics like Chase Brexton that provide services exclusively for them. I mean, it's there. It's you see it, especially with the Ryan White, those who are from the HIV/AIDS community. But just in general, it's not really that much out there.
Yeah.
Like it should be.
Mm-hmm. I can share a story that I have, Desmond, with a patient. I see mostly kids. It's about 80% kids, 20% adults, roughly. And there's this one patient that I've been seeing for, I say, at least 5 years or so. And well, he was born a she, but so we'll start with she was a she. You know, her name was Brittany. The first time I saw her, she was 8 or 9 years old. And over the years, you know, I've known her for about 5 years, like I said. So at about 12, 13, something like that, she came in with her mom and her sister, and there was a Post-it note on her chart, and it said, "Please refer to patient as Brian." So I was like, oh, okay. So my thought was, I'm gonna act like there's no different. There's like no different here. I've been seeing this kid for, you know, 5 years. Been calling him Brittany, you know. And I saw the note, and I was like, "What's up, Brian?" Like I didn't even like acknowledge any different or anything. But the issue we had was I work in like a kind of, it's not really a pedo practice, but we see a lot of kids, like I said. So we have like a main bay with the kids. And so we kind of jump around a lot. And I was kind of hoping to kind of be there when the dentist showed up. So he would see the note, you know, make sure he saw the note. And of course I wasn't there when he came, and you know, he called him Brittany. And I was like, oh God, you know, but just like simple things like that. Plus, you know, being 13 years old, that's like the awkward years, no matter who you are, you know.
Exactly.
But being a trans kid is even worse, you know. So, but.
Yeah. So yours, you handle it perfectly. I mean, the main thing is just being compassionate. When you think about everything that we've learned in school, we've taken an oath as dental hygienists to provide adequate care, to make our patients feel safe. And you think about ethical principles like beneficence and non-maleficence, and how we want to do good for our patients. So it's really important just to remind ourselves that it really isn't an us versus them. And if you treat them as a whole person, really none of that should matter. You know, I'm not going to introduce myself. Well, I haven't, like, hi, Mark, you know, I'm Jasmine, I'm a heterosexual.
Right.
You know, you don't want to come in and no, who does that? I mean, they would think that you're crazy. But it is important for us as healthcare professionals to think beyond the prophy, which is what my business is called, to really consider their impact on our impact as professionals. If we don't provide a safe place for them, how would this impact the patient's health? And so my experience, you did a great job. I didn't know what to do. Actually, when my first trans patient, I had received a chart that did not indicate the name that she wanted to be identified with. So I called her birth name, and she did not come up. It was like an open, you know, reception area. I called out her birth name. No one came up, but my computer said that the patient was there. So I walk back out into the area and I call the name again. Nobody shows up. I go back to my computer and I'm like, okay, you know, what's going on? My patient is here. I don't want to run behind time. Come back out, and there's a lady that's standing there. And then she asked me, did you call out so-and-so? And I said, yes. And she said, well, that's me. And I was like, my face was like, oh my gosh, what did I just do? Like, she was cool about it, but I was completely embarrassed. And so the first person that really needs to get the training is really the receptionist.
Right. Because
had they taken the time to do that, they're normally the first point of contact. Maybe that could have been avoided. That was my first time seeing her. So.
Would you say, Jasmine, that the probably biggest challenge maybe or difficulty for trans people is that like the interaction with the, whoever it is, I'm just in the general population with a clinician, you know, the right pronoun and that kind of thing? It's probably not, I mean, I don't know, I'm just guessing. It's not really so much the clinical differences, because clinically it's pretty much the same, I'm guessing.
Yeah.
You know?
Yeah, there's no major difference clinically, unless of course they're taking some type of hormonal therapy or they may identify as HIV positive. Then you may have to take in some different considerations. But it's the language, it's the terminology, and that's what cultural competency is. You're learning people's culture, but you're also trying to understand what to say, the terminology, and which is why I'm speaking about this, because for me, the pronouns were a bit of a challenge for me. And then especially when you look at pronouns, they're no longer binary, which means male or female. You have pronouns that are non-conforming, non-gender conforming. So they may decide to use thee or here, and then that opens a whole nother ball game when it comes to finding out what the patient wants. But simply what it is just asking them, what is it that they prefer? And one great way, especially when you think about the dental field, is a medical history form. If that's already included, you know, where you check off if you're male or female. If you have the question where is what is it that you identify with, or providing other options, that can then create the conversation for you as you're reviewing that medical history with the patient.
Yeah, I was thinking the same thing as far as the clinical stuff. Like, we have like other hormonal issues, like, puberty, pregnancy. So I was thinking that's probably like the only really issue. And like even that's not really a big deal. Like, it's just maybe
Right.
like exaggerated inflammation or something if you go and, your hormones are changing and stuff. But other than that.
Yeah.
Yeah, so let's get into the gender terminology. That's probably the biggest thing. Like in my reading, I've been watching a bunch of YouTube presentations and stuff. That's probably the biggest thing, and that's something that I kind of knew about. Like I've heard the terminology here and there, like with the whole bathroom law and all this stuff, like in the news and just hearing stuff. But that's something that I learned a little bit more as I read. So kind of get into that, like the distinction between like sex and gender identity and all that kind of stuff. Yeah.
Okay, so the main thing that everyone needs to focus on is, again, there's no us versus them. So actually, we all have a sex, which is our biological sex, our gender expression, our identity, and they're all independent. All independent. So just because someone may identify as a trans female, that doesn't mean that you know what their orientation is, their sexual orientation. So the sex will be biologically what you were born. Your gender identity is the feeling that you have within yourself of what you identify with. Your gender expression may have nothing, it has nothing to do with that. It's basically how you would like to express your gender. So you may be a female that prefers to express your self by wearing a suit and tie. And then we have your sexual orientation. So that's who you're attracted to. And so that kind of sums it up. I actually just had a manuscript approved to be published in July with Dimensions of Dental Hygiene. And so that actually goes into a lot more nitty gritty, all that terminology. So it can kind of help it'll be a great reference, especially when you're in clinical practice. Like, what's the terminology? Like, is this appropriate or not? What are some things I shouldn't say? So it goes further
That'd be
into
good,
there.
Jasmine. I'll add that as soon as that's published. I can add the link to the blog post and all that. So when people see this later on, they can link to it.
Okay, awesome, cool.
Yeah, so I just kind of came up with like an example. I don't know if it's a bad term to use or it's an old term, but I was going to say like a cross-dresser, right? So say you're like born a male, you're heterosexual, you're married to a woman, but you cross-dress. So you're expressing a female gender, but you're not, you're still a heterosexual, and so on and so forth.
Yep, perfect example. You identify as a male. Yep.
Yeah.
And you are so all of that is independent. So even though I'm not in the LGBT community, I have all of those. I have my biological sex, my gender expression, my gender identity, and my sexual orientation. All of that is completely separate.
Mm-hmm. Yeah. So that, for me, that was probably the biggest education from the reading.
Yeah.
Yeah.
Exactly.
Yeah.
Exactly. So it took some time for me to get used to, and sometimes you're it's just you just apologize, and a lot of times those in the LGBT community they love to educate as much as possible. I think the most important thing is to understand, especially when you're a new graduate, is how important self-awareness is. If you find that you're uncomfortable, you have to figure out why am I uncomfortable here. I think it's important to realize that when we have this conversation, we're not trying to change your religious views, we're not trying to change your political views, we're just trying to make sure that we maintain some level of safeness for our patients, because if you can't communicate with your patients, then that affects the patient attrition, and then ultimately some individuals, because of the lack of income, lack of insurance, they may have a multiple minority status. So what that means is that someone may identify as LGBT. They are also a minority ethnic wise. So, African American, Asian, and they may be female. And so when you add in all of those different aspects of being a minority, that adds to more barriers. So if they don't receive adequate care, a lot of times they refuse to seek any further treatment, which then leads to poor health. You may find individuals who are dealing with suicide more, higher rates with that. So there's so many things that affect this community because of not having all of the access of care that they need.
Mm-hmm. And I was thinking this too, Jasmine, that even if you're a person that disagrees with the philosophy or the concept or whatever, as hygienists, you know, we're public servants, you know, so we're obligated, no matter what you think, is to serve your patients and make them feel comfortable. So,
yep,
you know,
absolutely, yeah. So my love, it will always be #1, diversity, cultural competency, and then working with vulnerable populations. I think, and that ultimately goes with that. When you think about that flower that talks about all the roles of a hygienist, the biggest one is public health. And it's such an important aspect of our clinical care.
So tell us about your course, Jasmine. Is it an online course? Is it an in-person course, or what is it? CE course?
It's in person. Yeah. It's in person. Dimensions is actually going to be publishing it as a CE course.
Okay. So
that it can be taken that way. I'm going to be speaking at the ADHA CLL in Pittsburgh, and this one is just the multiple facets of diversity in dental hygiene. It's just trying to open the mind of the hygienist to consider things other than ethnicity with that. So I do in person, and sometimes I have community representatives with me. Van Meadows is one. He's one of the founders of Black Trans Men, and he was one of the panelists that I had in 2014. He was just absolutely wonderful. I think it's important to have that interdisciplinary approach when it comes to educating. That's the new way that we're evolving as hygienists. So there is in person, but you can also check out the Dimensions of Dental Hygiene article.
Where is the course being offered right now, and the in-person version? Is it? So
right now, I'm going to be just talking about diversity at the ADHA CLL. I'll be talking again at the Maryland Dental Hygienists Association in the spring of 2017. So I am hoping that this platform will allow more discussions about that. I think that a lot of hygienists and people that I've met don't realize how important it is to discuss this and its relevancy to our treatment of patients.
Very good. So anything else you want to finish up with, Jasmine? Any other points you want to bring up?
No, I'm just really excited to have had a chance to talk with you and talk a little bit about my new initiative. I'm really excited, really nervous at the same time too. It's like an excitement to be embarking on something that I never thought I would. I'm trying to take control of my career and actually offer education services. So we'll see where it leads. Either way, I'm going to have a lot of fun and get a chance to meet individuals like yourself and others. Yeah. So check out Beyond the Prophy. And interact with me. Would love to talk with you guys, and that's it.
That's the website, right? Jasmine, beyondtheprophy.com. That's your main website.
Yep, and they can find me on Facebook also.
Okay, and the whole world on Facebook.
Yeah, I try to take a break from it because it really will take over your life.
Yes, it will.
I tell you.
All right, Jasmine. So I want to cut it off there and just hang on for a sec.
Okay.